Welcome to Psychiatry Simplified with Melzi, where we break down mental health into simple, practical, and evidence based conversations. Hi everyone, I'm Melzi, a board certified psychiatric mental health nurse practitioner. And in each episode, we'll talk about real symptoms, real treatments, and real strategies to help you feel more in control of your mental health. All right, let's get into today's episode. Have you ever felt like your mind just won't slow down? Like you're constantly thinking, worrying, or overanalyzing things, even when there's no immediate danger? Maybe your chest feels tight, your heart races, or you feel on edge for no clear reason at all. If that sounds familiar, you're not alone. Today, we're talking about anxiety, what it really is, why it happens, and most importantly, the treatments that may actually work. Before we start, just a quick note, this podcast is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you have concerns about your mental health, please do not hesitate to reach out to a qualified healthcare provider. All right, let's start. So, what is anxiety? Anxiety is your body's natural response to stress. It's part of your built in survival system, your fight or flight response. This system is designed to protect you from danger. But with anxiety disorders, that system becomes so overactive. So instead of turning on only when you need it, unfortunately, it stays on even when you're safe. Clinically, anxiety can show up as conditions like generalized anxiety disorder, panic disorder, or social anxiety disorder, which is also called as social phobia. And biologically, it involves areas of the brain like the amygdala, along with neurotransmitters like serotonin, norepinephrine, and gamma aminobutyric acid or GABA. Let's talk about the symptoms. Anxiety doesn't just affect your thoughts, it also affects your entire body. Mentally, you might experience constant and excessive worry that is so difficult to control, racing thoughts, or difficulty concentrating, which can also affect your daily functioning, such as doing your job or even, doing your household chores. It can also affect your sleep, which can lead to insomnia. Physically, you might notice restlessness, uneasiness, or feeling on edge, fast heart rate, shortness of breath, fatigue, where you get easily tired or worn out and irritable, muscle tension, which are mostly felt around the shoulder area, neck, or jaw. Behaviorally, anxiety can often lead to avoidance, like avoiding the situations, conversations, or responsibilities because they just feel overwhelming for you. And over time, this cycle can make anxiety even stronger and will significantly affect your personal, social, and occupational functioning. The good news is anxiety is very treatable, and the most effective approach usually includes a combination of therapy, sometimes medication only, or a combination of both therapy and medication, and lifestyle changes. Let's go through each of these so you understand what actually helps and why. Number one, therapy. The first line of treatment for anxiety is therapy, especially cognitive behavioral therapy or CBT. CBT helps you identify unhelpful thought patterns and replace them with more balanced, realistic ones. For example, if you are thinking something bad is going to happen, and that always it repeatedly comes into your mind, and with CBT, it will it will try to change into I've handled difficult situations before. So, even if something bad happened, you've had more bad situations before and you were able to cope with it. So, it kind of turns a negative thought to a positive thought, or it kind of challenge your negative thoughts, you know. Another effective approach is exposure therapy, where you gradually face the things you fear in a controlled way. This can help reduce avoidance and retrains your brain over time. This one can be very difficult to those who have severe anxiety, but if you do it very gradually and if you do it consistently, I know that it will help minimize anxiety. Another one is mindfulness based therapies such as meditation, breathing exercises, and present moment awareness. This can also be helpful. They focus on staying present instead of getting stuck in future focused worry. Second one is medication. This is usually used for moderate to severe anxiety, which medication can be very helpful. The first line medications include selective serotonin reuptake inhibitors or SSRIs, such as sertraline, escitalopram, and fluoxetine. And the second one is selective norepinephrine reuptake inhibitors or SNRIs, such as venlafaxine. So both SSRI and SNRI are the first line medications due to their tolerability and safety profile. This medication works by increasing the serotonin and norepinephrine levels in the brain, which can help regulate anxiety. However, they don't work immediately, as it usually takes about 2 to 6 weeks to notice improvement. And this usually frustrates the patients, especially if they want the now effect. But we always have to tell them that this medication takes 2 to 6 weeks, and sometimes it will not be effective, and hence we will need to try another type of medication. And it's very frustrating for sure. Second line medication includes tricyclic antidepressants or TCAs such as amitriptyline and monoamine oxidase inhibitors or MAOIs such as phenelzine because of their side effects and tolerability profile. So if the first line medication did not work, then we'll try the second line medications. Other options include buspirone and hydroxyzine, which can be helpful depending on the situation. So buspirone works by increasing serotonin activity in the brain, reducing anxiety. The good thing about this medication is that it does not have risk of dependence. Hydroxyzine is an antihistamine that can also treat anxiety and muscle tensions. It works by reducing activity in the central nervous system, causing side effects such as drowsiness and sedation, which leads to calming the body. Another medication for anxiety is benzodiazepines like lorazepam or alprazolam, and they can reduce anxiety very quickly. We usually use this for acute anxiety, severe anxiety, or panic attack, but they are typically used short term due to the risk of dependence. So, we have discussed psychotherapy and medications as treatment for anxiety. The last one is lifestyle support. So, lifestyle changes can make a significant difference when it comes to managing anxiety. And sometimes, these are the most overlooked part of the treatment. Let's start with physical activity. Regular movement has been shown to reduce anxiety symptoms and improve overall mood. This does not mean you need intense workouts. Even something as simple as walking for about 30 minutes a day can help regulate stress hormones, improve sleep, and give your mind a break from constant worry. Sleep is another critical factor. When your sleep is disrupted, your anxiety often worsens and it becomes a cycle. Try to go to bed and wake up at the same time every day, even on weekends. Limiting screen time before bed, especially from phones or tablets, can also help your brain wind down more naturally. Caffeine is something many people don't think about, but it can significantly increase anxiety. It stimulates your nervous system, which can lead to symptoms like racing heart, restlessness, and increased worry. If you notice your anxiety is worse after caffeine, it may be helpful to reduce or gradually cut back. This is hard though. Mindfulness practices are another powerful tool. Techniques like deep breathing, meditation, or even just taking a few moments to focus on the present can activate your body's calming system, the parasympathetic nervous system. This can help reduce anxiety in the moment and improve your overall stress response over time. Some supplements, such as magnesium or lavender, may provide mild support for anxiety. However, this should be used cautiously. They are not a replacement for evidence based treatment, and it's important to consider possible interactions with medications or underlying health conditions. And finally, for individuals with more severe or persistent anxiety, research consistently shows that a combination of medication and psychotherapy is often the most effective approach. Psychotherapy helps address the underlying thought patterns and behaviors, while medication can help regulate the biological aspects of anxiety. The key takeaway is that lifestyle changes are not a quick fix, but when used consistently, they can play a powerful role in improving anxiety and overall mental health. So, when to seek help? If anxiety is interfering with your daily life, such as your work, relationships, or even sleep, it's important to seek professional help. You don't have to wait until it becomes severe. Early treatments lead to better outcomes and can prevent symptoms from worsening over time. Anxiety is very real, but it is also very treatable. With the right combination of therapy, support, and sometimes medication, it is absolutely possible to feel better. If you found this episode helpful, consider sharing it with someone who might need it. And if you'd like more simple, evidence based mental health content, make sure to follow or subscribe. I'll see you in the next episode. Thank you so much for listening to my podcast, Psychiatry Simplified with Melcy. Until next time.